Thank you for the introduction, Lucy. It's always good to have an opportunity to present to the oil and gas sector. We have established a tradition, I think, for well over 20 years now, where we have a session like this, and it used to be in person in different places in Fort St. John. We did it in Grand Prairie. We traveled down to both Edmonton and Calgary at different times, and have had the opportunity in the past mainly to do this face-to-face. And post-COVID, now we've basically, I think, realized some of the advantages of virtual presentations is it allows a lot more people to participate, come in and both hear and ask questions and look at what are some of the key things that we are going to be moving forward on as we go into 2024 and this next year's drilling season. Just a couple anecdotal things before we get into some of the detail of it. In October of this year, the Coastal GasLink pipeline welded the last joint of pipe. And so that pipeline now, in essence, is mechanically complete. They still had some compressor work to finish off, but they're ready fairly shortly to start doing the final testing and being able to put the line into a commissioning state and get it ready for the transportation of gas to the LNG facility in Kitimat. And I had the opportunity in October as well to visit the LNG facility in Kitimat. To say the least, it's an impressive facility. It's the largest LNG loading facility in the world. And there was a lot of interesting work and systems put together for that facility. And we're only at phase one. They are contemplating a phase two for both the pipeline upgrade on its compressor capacity as well as production of the LNG loading facility itself. From our side, that means that activity in northeastern BC will continue to be strong. The need to fill the contracts and send the gas to Kitimat will definitely be seeing an impact on the activity in northeastern BC. And with that will come a whole new slate of challenges, basically bringing back equipment and personnel. We hear a common theme across industry sectors is the challenge of getting people, and especially getting experienced people that you need for critical tasks as you move along. So we'll basically face those as we move forward with oil and gas, and hopefully we're able to manage them appropriately and correctly. So today we're going to start off with, we did with some introductions, basically talk about the oil and gas sector itself, some of the updates. This is some of your basic stats. And then we're going to talk again about risk management basics for oil and gas. And I say that again because we did talk about it at the Petroleum conference in May, and we gave an introduction to risk management basics there. And hopefully in the intern months, there has been some interaction with the officers who have been doing inspections focused in this area, and you will have maybe some additional questions about how we're moving with that one. One of the key areas of interest always are field issues. What are some of the incidents and compliance challenges that the sector has experienced in the last year, and really taking that information forward so that you're able to overcome those. We also are going to bring forward today 2 sector questions that were asked of us, and we thought it would be appropriate to share them in a public setting, the questions and the answers. The next one is the new regulation update for first aid. And so we're going to talk about the significance of this. This is a pretty significant change. The first aid regulations that you currently have right now have been in place for approximately 20 years. And so it's a pretty significant change. And we want to make sure that the industry sector is prepared for those changes and meeting some of the challenges that they'll be present. And we'll end today with some questions. And as Lucy alluded to, each section of the presentation has a sectional divide question, and if you haven't already asked your question, you might want to wait for that. If you want to basically put it in the chat, do so earlier. But at that stop section, I'll try and answer any questions that have come up or questions that you may want to ask at that time. So let's start with our sector update. So how's the oil and gas industry been doing when it comes to injuries? So what you have here is basically a very short comparison slide on the injury rate between all of BC and those that are specific to oil and gas alone. So working from the left over to the right, you can get a perspective on the number of claims over the last number of years. We're looking at 6-year span there. And 2023 is not complete because the year hasn't ended. But you might be interested here to looking at some of the costs. Despite the lower ratios of claims, there's still some pretty significant costs that have come out of the claims that have been occurring in different sectors. The injury rate for all of BC right now rests at 2.5, and that is up slightly. A big influence in that change was the pandemic and the number of accepted COVID claims. The other area of challenge has been the increasing number of mental health claims that are coming into the system. And so they impact pretty much all sectors, certain sectors a lot more than others. So on the far right, you have the oil and gas injury rate. And it was pretty stable up until 2021, and it started to increase, and it increased it last year to 0.5. Now, it still is an extremely low injury rate, and so that's a good thing to see. And the challenge as we move into periods of higher activity is to make sure that we're not generating more injuries as we do more work. We may see some of that trending. People ask us, when you look at your data, how do you get this data when you're comparing it? We have an information sharing agreement between the Canada Revenue Agency, and we're able to get information on the number of hours that are worked, and through that we have some fairly sophisticated processes where we can come out with the injury rate. So the next one has to do with serious injury claims. So the top one is time loss claims. The next one is serious injury claims, and they typically serious injury claims of the longer duration. So at least 6 weeks of time where the worker has been off, collecting compensation benefits, going through medical treatment typically during that time. And the serious injury rate in oil and gas has stayed pretty stable. Your sector is quite well known for claims management and doing significant things to manage claims, so that may be a factor in keeping that down. So good news at this point, the injury rate is low, continues to be low, but it also means that we need to keep sort of a vigilant eye on what we're doing and making sure that people are not being injured and that we're not generating aspects that would raise this. Let's go on to our next slide. So this gets into accident type, and it basically talks about for oil and gas, what is your most common type of claim? And we've highlighted those. So in the top 5, overexertion. So that stress, strain type of claim is your number one claim. 14.8% of all of your claims have to do with overexertion. And so we're going to talk about it later on, about one of the emphasis in our high-risk strategy for oil and gas is on musculoskeletal injuries, which are a direct aspect of overexertion challenges that come up. So what can we do to do the work differently and to do the work in a manner that reduces risk, and so that we don't have as many overexertion claims as we're getting. Number 2 is exposure to toxic substances. And I do have some slides later on about the fatalities that have occurred in oil and gas and that have been accepted this year. And this basically is a key area of our focus in the strategy is occupational disease. What are we doing to eliminate, to mitigate the potential for exposure to toxic substances? Your industry has lots of different types of hazardous substances that have varying degrees of toxicity and outcome for the persons who may be exposed to them. But we want to make sure that we have proper exposure control plans and that we're working at the right level of the hierarchy of controls when we're looking at ways to control these exposures and mitigate this risk. Fall on the same elevation, slips, trips, falls, tripping problems, different types of weather, different types of condition, and even the selection of footwear influences. In a typical year in British Columbia, we will have at least 8 fatalities that occur from falls at the same level. Someone falls and hits their head. Yeah, so significant factor. Next one is struck-bys. In the oil and gas industry, a lot of your struck-bys generate long-duration claims because they typically, someone gets hit by something that's made out of metal, piece of pipe or something like that. And those tend to end up in having pretty serious outcomes, and debilitating injuries to the workers. And the next one is falls from elevation. So it's not just the oil and gas sector, but one of your contributing elements or to the injury rate for the province is the construction sector itself. And in these stats here, we're not basically recording your actual construction work. So if you're building a new plant or a new facility and you're bringing in construction contractors, it's not recording it in this data, but it's a parallel data that could be occurring from the same types of things. Falls from elevation basically requires to take a look again at how are we doing the work? What are we using for controls? Are we focusing on putting people in harnesses and lanyards, or are we looking at ways that we can actually engineer some of the control risk? Looking more for things like guardrails, looking for being able to do the work at a non-elevated location, where we can do the work on the ground and then put the component part into place. And last but not least is motor vehicle incidents. There's been a significant number of them provincially. And I'm not sure if you're aware, but last year the provincial government changed the legislation in regard to ICBC claims and workers' compensation claims with motor vehicle incidents. So now if you are involved in a motor vehicle incident and it is work related, so you're being transported to and from work or part of work, in the past you had the option to elect to either claim through ICBC or to claim through WorkSafeBC. Now all of those types of claims are through WorkSafeBC. So they've changed the way, so this will impact your injury rate, motor vehicle incidents. So a great place to start looking at how can we reduce the risk here. And we talked about 10 years ago about looking at not sending a whole bunch of pickups and crew cabs to job sites back and forth, but to employ professional drivers and busing more people, putting them in vans, putting them in Suburbans, basically, but being driven by professional drivers. And I would challenge you to revisit that. What are you doing around driving? What sort of monitoring systems do you have on your vehicles? The reality is out there is the company that have onboard monitoring systems have lower motor vehicle incidents. As people know that they're being monitored, they tend to adopt appropriate behavior in that context and are driving basically more appropriately to conditions, speed, all of that in regard to it. I'm not going to go through the rest of them, but it gives you an opportunity to take a look at it on your own leisure as to some of the areas. And it may be some of those areas where you want to adapt your own health and safety program. Are these some of the things that we're targeting in our own initiatives for injury reduction? So some of the sources of injury, so we talked in that previous slide on outcomes, and now we're talking about sources. Where are these accidents in essence occurring? So floors, walkways, those type of areas are your number one. So slips, trips, and falls on your floors and walkways. This is a scenario where you want to take a look at, especially in the winter time, as we're getting into slippery conditions, icy conditions. What are you doing to actually mitigate the risk of slips, trips, and falls? What type of sanding, what type of control do you have in people? Hopefully you're not just putting PPE on their footwear, putting traction aids on them, but you actually look first and foremost at ways that you can mitigate or eliminate the risk. So number two is people. Interactions with people, contact with people. That's often a key element in a motor vehicle accident, is a collision between people that may occur, especially if they're not wearing seat belts. And so looking at your operations, where is it that you have interactions with people that have generated injuries because of collisions and other types of components, or people dropping things, etc., that can generate injuries. Number three, land vehicles. So motor vehicle incidents, land vehicles, either incidents that occur as you ride in them or being struck by. Significant number of struck by incidents across industry sectors. So thinking about anywhere where you have worker vehicle interface or mobile equipment interface, what are you doing to try and mitigate that risk? Making people more visible helps, but also are you looking at things like detection systems on vehicles, sonar, RFIQs that basically workers can wear on their hard hat, and then you have base stations on vehicles, and making sure that those systems work properly, that they not only alarm, but as people get very close to vehicles, the better systems will actually stop the vehicle. And the next one is infections and parasitic encounters. So infections would have included COVID infections, and your sector had its share. And so that would be a big part of it. And again, I'll leave this slide for you to peruse and take a look at some of the things in your operations and sectors that may be factors here that you want to focus on. So this now talks about, we went from the type of injury to the source to what are some of the nature of the injuries. Our stats folks have extracted that there is an increasing concern with what they call long duration sprains. And if any of you have ever suffered a sprained ankle, it can often be described as being more debilitating as a fracture. And it can actually have longer ramifications of it. And so as they've been tracking this, they've found that there's this trending to see these long duration strains. So if we go back a couple steps, we want to think about what is the things that we can do to interrupt this so that we don't have these long duration claims. The next one is fractures. Typically fractures are the result of being struck by. So being struck by maybe that piece of pipe, that piece of steel, by another vehicle, or riding in a vehicle. And so those are some of the things that we can expect. And these are the type of injuries that are the ones that become serious injuries. They have the longer duration. People are off work longer. It takes a lot longer to recover when you have to heal a fracture, go through all of the therapies and components that are related to fractures. And typically, if you suffer a fracture in a body part when you're younger, later on, you're going to have some sort of debilitating problems with it because of arthritic issues or other things that can occur because of the damage to your bones. We talked about some of the exposure issues earlier. The next one, the nature of industry, is respiratory inflammation. So that can be the outcome of being exposed to some of these products. And you want to take a look at, what you're using and what you may be exposed to, what's the inhalation risk, and what then is the respiratory problems that may evident that you're having exposure problems. And anytime you're doing that, you've got to be looking at exposure control plans. What can you be doing to hopefully eliminate that risk? And if you can't eliminate it, to mitigate it down there. Next one is back strains. From lifting, stress and strain, we talked about that earlier, strain injuries. Back strain specifically, more often than not, back strain comes out of some sort of hyperextension or extra load that you've put on your back and generates a significant injury out there. So the list keeps going on, but one I want to point to here, and this is an area of growing concern, and I actually will talk about it a little bit later on a specific slide, is mental disorder. So across the country, across North America, across the world, mental health issues at work and that are work-related have been growing exponentially. We're averaging well over 1,500 mental health claims a year, accepted mental health claims a year in British Columbia. And I know that in other jurisdictions, there's similar numbers to that, where mental health problems in the workplace are being evidenced and are generating compensation claims because of what's going on. This is especially evident following the pandemic. Many people were very isolated. They had significant challenges during the pandemic. So post-pandemic now, as we get back into a more normal workplace, all of those things that may have impacted that still haven't gone away. And so we now have these additional challenges of the stress and mental strain that occurred during the pandemic, and we need to be able to cope with them. Last year, I was speaking to a group of contractors working on one of the major pipeline projects, and they talked about as they move forward in the future, they say there's really going to be a need for someone in the health and safety department to be a key resource, or a contractor who could be a key resource for them to help them in this area. They know it's an area that they're struggling with. And many employers say that as to how to support their workers appropriately and help them to cope with some of the challenges they're having in life, and to continue to be able to move on and become healthy, productive workers for them in that process. So this is what we've had year to date for our fatal claims. There's been 148 year to date, and that was last week. So I did this research on it last week. Now, there could be some more claims, and this morning I got an email about an operation up in northwestern British Columbia, and unfortunately a forestry worker was killed this morning. And that's the type of information we get on a regular basis with WorkSafeBC. We're quite well aware of what's going on, so these numbers are going to be moving in different directions. What's interesting to see is that as of last week, it's an equal split between occupational disease and single incident. So we're looking at occupational disease versus traumatic injury. And then when we go down, there's been, they break it out a little bit further, other types of injury, break it out with what has been asbestos exposure, other types of occupational disease, and that list is growing. And we're seeing some significant growth in things like silica exposure. Down the road, they anticipate that silica exposure will probably eclipse asbestos exposure as the #1 fatal factor or fatality factor for an occupational disease fatal.
Excuse me, Bud?
Yeah.
Can we just clarify, this is across all industry sectors in BC?
This is all industry sectors. Yeah. I will give you some specific slides for oil and gas too. but this is them. The
Thank
other
you.
one is motor vehicle incidents, and partly because now these become fully compensatable, they're focused on that, and we're not going through ICBC, we see them here. You may have heard this summer about an unfortunate scenario where a wildfire crew was moving from one location in southern BC. They were heading for days off into northern BC, where they called their home, and all 4 workers in the crew vehicle were killed in a head-on collision with a truck. And so those types of incidents are the things that we're definitely wanting to avoid. So this is for the oil and gas subsector. So this is 740. This is what we call kind of the essence of the oil and gas sector. So this is oil and gas production, drilling, geophysical, and seismic. Basically that gets recorded here. It has definitely gotten a lot lower, and it may relate to some of the activity, but you have 4 single incidents and 1 occupational disease this year. So we don't have any other breakdown with it, but so there's been 5 accepted fatal claims this year for oil and gas. Typically, in years past, we used to have between 8 and 12, and often if it was around 8, those would be all motor vehicle incidents. That would be fatalities. And then you might get 3 or 4 that would be other types of incidents. Now, the breakdown here, basically, it doesn't give us, but this gives us sort of the worker counts over time, so you can see it. And it takes you back to 2001. So you get to see quite a difference in the variations on worker deaths. Still in your sector, the #1 fatality causal factor from traumatic injury is motor vehicle incidents. So it helps you when you're looking at that. What can you do to improve driving habits and your vehicles that are on the road? The challenge can be that when you're driving, you don't have any control of the oncoming traffic. So what can we do to focus on our driving habits to make sure that we're not doing things that put us at risk? Now, for those of us who travel in the northeast part of British Columbia, I would say there's still lots of work can be done there. I have been passed this year numerous times by oil and gas vehicles that were excessively speeding and passing in some very challenging locations where they shouldn't be. And that's just on the Alaska Highway. So, there's areas that we can improve this and things we can do to hopefully change it. This is the inspection activity. So we shifted a little bit. So we looked at claims. There's always a lot of interest. So what is WorkSafeBC doing in regard to inspections in the oil and gas sector? Now, this first slide is oil and gas inspections in the province of BC. So this isn't just in the Northeast. This includes places like the Trans Mountain expansion work. It would include Coastal GasLink, and it would include LNG Canada. Plus, it includes the work that's going on up in northeastern BC, and gives you an idea that, okay, here's the scope of work, and here's the scope of the inspections that WorkSafeBC is doing. So year to date, we've done 296 inspection reports. And that meant that we visited 143 different locations. Our target was 211, so we exceeded the target goal. And the inspection focus count was 230. Some of these aren't going to make a lot of sense for you, so I'll sort of skip that. But the next one, 22, it says inspections with potential for a high risk violation order. So 22 times an officer was at a site, inspected it, and issued an order that by policy could be designated as a high risk violation. And any time an officer does that type of an inspection and issues that type of an order, they actually have to consider whether they need to do something to motivate the employer to improvement, which can include penalties. So those type of violations are one way that penalties can be generated. The next one is follow-ups. So out of the inspections that we did, there was 66 additional follow-up inspections where the officer went back to the site and was back there validating what was going on. So out of all of those inspections, there was 237 orders issued. So orders are where an observed violation or evidenced violation of the Occupational Health and Safety Regulation or the Workers' Compensation Act was noted, and they issued an order for corrective measures. And out of that, then, and going back to that specific number, is 13.1%. 15 different times, the officers issued a stop use order. So some sort of tool, implement, equipment basically was in the type of condition that it shouldn't have been used, or it lacked maybe key certification requirements that would allow it to continue to be used. So they would issue that order, and you can't start using that piece of equipment again or device until whatever was wrong with it or whatever was omitted is fixed, corrected. And if it needs recertification, it would be required to have that certification in place. The next one takes it up a notch. So this is 4 times they issued stop work. So something that was going on was such that it was classed as being high risk work and had a high level of potential for injury of workers. And so they stopped the work. It's not just a piece of tool, but they actually stopped the work, the number of things that were going on, or the type of work that was going on. The next one is 2 times they did what's called a temporary cessation of work. So this is something that could be fixed fairly quickly, maybe a tool that was broken or needed to be replaced, and it was just a short duration stop until it was fixed in that type of a scenario. Further to that, there was 6 times that warning letters were sent. So these are a letter that basically talks about the inspection, the orders that were issued, whether they were high risk violations or repeat orders. And this letter gets sent to the senior most manager of the company. So typically the CEO of the company gets this letter, and it basically says, these things occurred on your job site on such and such a date, and we need you to take, pay attention to this and hopefully make sure that it doesn't occur again, because if it does in the future, you may end up getting a penalty imposed on you. Usually letters like that generate a fair amount of action on the part of the employer and issues at a job site. We also issued 5 penalties. So the scenarios of high risk or repeat were such that motivation was needed, and WorkSafeBC operates on a administrative penalty system, and so we don't have to go to court. It basically is the type of penalty that we can issue on an administrative violation. Policy sets how much it is, and it's largely based on your payroll. So the larger the payroll you have, the larger the penalty that can occur. Right now, the stat max penalty is just over $700,000. And so that doesn't require anyone to be hurt. It's basically looking at what were the circumstances, the risk involved, and what is needed to motivate the employer. And the next one is consultation reports. So these are times that WorkSafeBC officers have interacted with different employers, and they made a record of what the interaction was about. Basically, whether it was a question that was asked, a discussion that was had around how to do something properly, what was needed for compliance with the regulation. So that's often how consultation records are utilized. In the bottom here, it gives you an overview of the orders with potential high risk violations. And so you can see that they've all, not all, most of them have been complied with in the blue. and the black ones are closed, meaning that full compliance has occurred and the order is no longer active, but there's still a few outstanding, so follow-up is needed. If you go across, you can compare, okay, industry sectors. So not all of these are oil and gas specific. You can see that some are construction, some are first aid services, crane operation, general trucking. But the key one that a lot of folks are interested in is this one. What are the top 10 regulations that were cited in regard to the inspections that we talk about? Now, this first one, I would say in some ways is a bit disappointing because it's to do with first aid procedures. And the regulation outlines 6 key elements that need to be in your first aid procedures. And what seems to be occurring is that on many inspections, when the officers asked to see their first aid procedures, they're given an ERP, but the ERPs are incomplete when it comes to the actual first aid procedures. So the importance of these procedures and ultimately what is needed to practice them and to orchestrate them properly often don't get appreciated until you have an incident. And then it comes up the question, okay, who's going to do what? What is the roles? What are the responsibilities of the parties in this? And that's what the procedures help you outline, is what is needed and, to make sure it's in place. It changes with different job sites, but it's specific to that job site. The next one has to do with stop use, and supplying unsafe equipment. So this is an order under the Act, and it's considered to be a fairly serious, significant one. 4.3, this is a general obligation around safe equipment and machinery, that it basically is safe to perform its function and use. 4.43, this is to do with the stacking and loading of materials. So you have a warehouse at a job site. Do you have the proper information for shelving? Have you been loading it properly? Does it basically being loaded within the standards and specs that are outlined by the shelving manufacturers that you've used? 68.1, immediate notification of certain incidents. So the Act outlines a number of key things, fatalities, serious injuries, structural collapses. You want to make sure exposure to toxic substances, that you have a well outlined procedure for what is immediately notifiable to WorkSafeBC. So some things that this procedure is not. It's not the filing of a Form 7. So the Form 7 is a report of injury, and the policy on this actually says that. Filing a Form 7 does not constitute immediate reporting. And we classically will say that immediately reporting is you look after the injured party, if there's somebody who's been injured, and as the tail lights of that transport vehicle are leaving the site, you're phoning WorkSafeBC. And that's part of the time where we have dialogue around what to do. Are you going to be preserving the site for a board officer to attend or investigators to attend? But really, what's the expectation? Talk about the investigation that needs to be conducted as well. So that's a good one to have on your radar to make sure that you're compliant with that. 2078, work standards for excavations and instructions. This is an area that has been popping up in oil and gas recently as a significant area of non-compliance. You guys dig lots of ditches, especially pipelining and those different types of things, or repair work. Take a look at that regulation, what it says when you're doing work adjacent to improvements. What do you need to have in place? And it basically is telling you that if you're doing work adjacent to improvements, the guideline tells you what adjacent looks like. Then you have to have engineering documentation that it's safe to do the excavation the way that you're going to be doing it. Because typically, an improvement definitely has the potential to impact the stability of your excavation. and to make, whether it's going to be safe for workers to enter or not. 557 is exposure to designated substances. And so this is designated substances, and it lists the hygiene associations that have outlined what are the key designated substances. These are typically substances that have known human carcinogenic properties. And so first obligation is, what can you do to substitute, to get something that's safer out there? If you're not able to do that, what do you have in place for a proper exposure control plan that's comprehensive and will protect the workers that you need to be protecting? 68.2 goes back up to the 68.1. So often when we see a failure to immediately report, the next thing that may occur is they disturb the scene. So key part of the obligations of the parties at the site, whether it's the owner, prime contractor, or the employers, is to preserve that scene and make sure that you preserved it for WorkSafeBC to attend if needed, but also for your own investigators to do the investigation. Pretty hard to do a good investigation if the scene has been disturbed and they don't see, what were the key contributing factors. Next one is 321. The responsibility of the first aid attendant. This actually goes back up to 317. So the regulation basically outlines that when it comes to the injuries of a worker and the treatment process for injuries of a worker, it's the responsibility and the call of the first aid attendant. So supervisors, superintendents, owners, etc., different parties, you should not be interfering in that call. If the first aid attendant is saying we need to transport this worker to a hospital, that's what you do. They're basically looking at what treatment is needed to preserve the individual's life in that situation. And the last one, ladders in use not meeting acceptable standards. So make sure that whenever you pick and choose ladders, that they are meeting appropriate standards and are also used properly, because there's lots of nuances to ladder use. So as I said, this slide gives you oil and gas inspections year to date across the province. So this next one is specific to the oil and gas CUs themselves. It doesn't include a bunch of additional CUs, but this is in northeastern British Columbia. And a little bit of the nuances of the regulations that are top cited are a little different. A lot of them have overlap, but there are some that are a little different. I'll let you read the slide on your own because it talks about the numbers and it talks about the focus area. Year to date, we've had 2 penalties imposed. We've had 5 warning letters. And when we look at the top regulations cited, in northeastern BC, the #1 regulation cited has been disturbing the scene of immediately reportable incident. And the next one is not immediately reporting a fire or explosion. So that's a new requirement that came in a few years ago, basically, that some employers are not aware of. So immediately reportable includes any fire or explosion that had the potential for causing injury to a worker. So that's what you need to be looking at in regard to it. So if you go down the list, most of the other regulations I talked about earlier, and you can review them basically on your own time as you go through that. Okay, so that brings us to the end of that section. Lucy or Jason, Jordan, is there any questions that we want to address now?
Yes, but a few have popped up. So the first one refers to part of the regulation 23.69.3 bracket 1A. Well stimulation and similar operations pumping continues to be directed to well testing flowing by an officer in Northeast BC. Why is this being misused, considering that this section of the regulation was and is focused on higher risk pumping operations?
Good question. Basically, when we look at the original implication of that regulation and imposition. It was basically intended to address all high pressure situations. It wasn't just specific to one type of operation. And if you want some more clarity, there is actually an extensive guideline on this as to its application. So it's not being misused, it's actually being used appropriately.
Okay, next question, maybe I'll take. It's someone saying they've observed ESC, Energy Safety Canada, doing a lot of great work in conjunction with Alberta OHS with creative sentencing. What would it take for WorkSafeBC to do the same? And what I would say is that ESC has shared some of the communication and successes we've had with creative sentencing with WorkSafeBC. So yeah, that question has been raised and there's been some interest shown. So we've shared what we've done. Thank you for that. Third question, does the existing underground facility constitute an improvement or structure adjacent to an excavation?
Yes, it does. So you think about an existing facility, what they're looking at is what was it that disturbed the soils in essence in past life or past times, and that now may have an impact on you going in to dig another excavation or hole. And so those are definitely the type of things that we look at. So roads, buildings, poles, those are all things that can have impact on the excavation and be considered to be adjacent to.
Okay, thank you, Budd. If there are no more questions at this time, we'll carry on.
Okay, good, great. So in the oil and gas initiative, the question comes up, what are you going to be focusing on over the next year and into the future? So you may have seen actually this slide before because it used to end at 2021 or 2023. We've actually just recently have added a year to this. And so we're going to be continuing on over the next year. And basically, we're going to be focusing on much of the same things that we have been. And the basic reason is because we still haven't seen the level of risk reduction that we want to see in those areas. And so we'll continue to be moving our inspectional focus and probes into those areas. They're not moving, but continuing with them. So some of the things that we're looking at and what our goals are, we're looking at definitely those things in your sector that generate our serious injury claims. What are those things that are causing debilitating injuries and or death to workers? So that's what we're continuing to focus on. So anywhere where we've had serious injuries, where we've had fatals, but the other thing is repetitive injuries that have generated lost time. That is going to be a focus across the province in all sectors that are generating significant MSI injuries that have significant cost and duration to them. And that's where I talked about those higher level strain injuries. So in your own operations, take a look at those things that are causing your stress, strain, and repetitive motion injuries. What can you do to eliminate that? Because that's your first obligation. Are there ways that you can do the work differently? Are there tools that you can use that will basically eliminate that process? Because that's a key part of it that we're going to be looking at in the province. 30% of all accepted injury claims in the province of BC are MSI based. And so we want to continue to have that strong focus there and take a look at what you're doing. So you have lots of jobs where you have heavy lifting. You have lots of times where you're doing things like installing hammer unions. You may have some difficult valves to open and close, and take a look at your own stats and ask that question. So where have our injuries been occurring? And what can we do to change the way we're doing it? What can we do to make it better and reduce that risk? So key challenge there. We're also going to continue to look at fire and explosions, well servicing and waste disposal. Those are a couple key areas that we continue to see fires and explosions. This is catastrophic risk. This is where there's the potential to not only hurt one person, but also to impact everybody on a job site with fires and explosions if we don't control them properly. We want to make sure that there's proper controls in place for hazardous energy, which includes static electricity. Your work, in many, many cases, generates a huge amount of static electricity, which can be a significant ignition source with the type of vapors that you guys are dealing with and the potential for it to ignite things. Continue to look at pressure management control, which includes flow piping systems. So it goes back to that earlier questions. We're going to be looking at flow piping and pressures and whether those are properly controlled and restrained as needed. You know, one that sort of jumps up at you, and this is across all sectors that employ hand fallers, and it shouldn't be free falling, it's tree falling. The supervision to the level of risk. Do you know what that means? What does that look like? You know, tree falling is the most hazardous occupation in North America, without question. It has the highest injury rate in British Columbia. But do we understand the risk associated with it? And are we supervising that level of work to the level of risk? Do we have appropriate, qualified, certified people in place to give oversight? Pipeline construction, it's slowing down as far as the big projects go, but the mechanisms of injury don't go away. They're basically the same as they have been for the last couple of years. The dominant mechanism of injury is knee injuries, and it's from jumping off of mobile equipment. So landing on the knees, lots of stress, strain. What can we do to make access easier, access and easy egress onto our machinery easier so that workers aren't hurting themselves unnecessarily? And followed with that is occupational exposures. I was just at a meeting last week in Richmond, and the CEO of our organization and the board of directors have come back and said, with that continuing high level of occupational fatalities in British Columbia, we want occupational exposures and the reduction of this risk to be a key part of any of our strategies, which includes oil and gas. You know, so we want to make sure that we're managing that risk, that we're doing the proper assessments of the risk, and that we have appropriate exposure control plans. I'm going to talk a little bit more about that when I get into some of the specific details of it. Okay. So one of the things that was just added in this past year is what we call risk management basics. And the inspections will include risk assessment and effective controls. So we're fortunate in our occupational health and safety regulation that we have a regulation that requires a risk assessment. And so it makes it a little bit easier, but we want to make sure that we're doing these inspections on a consistent manner. And I'll talk about them in a little bit more detail. I have a specific section on it. We're going to continue to support the development of tools and resources relating to safe work procedures in high-risk operations. Continue to work with Energy Safety Canada and any of the other industry trade associations to see that their initiatives align with mitigation measures related to strategic focus areas. And as we're doing today, to deliver key messaging and information to employers and workers through the HSAs and the other associations. So we have members of our team that participate in quite a few different meetings with different JOSH committees within the associations, and we want to continue to do that and message that out. So this is a new section again, Lucy. Do we have any new questions?
Yeah, just one question, probably related to your forestry hat. Bud, can you provide clarification on the QFS role? Can the QST be the QFS? Can the QFS have another role on the project?
Can the person who asked the question, can you clarify for me what you're relating to as a QSS? What is that?
No, QF for Frank, S.
Oh, QFS.
Yeah, pardon me.
Qualified falling supervisor.
So
Okay, qualified falling supervisor. And what's the other role?
the QST. So they want clarification on the qualified falling supervisor role. Can the QST also be the falling supervisor? And can the falling supervisor have other roles on the project?
That's actually a good question. A QST can be a qualified falling supervisor. Basically, if they have training around what is their role and responsibility, because the regulation has some specific details on things that they need to know and the things that they need to be managing and the things that they need to be involved in. So they would need that additional training in that area. And the other question is, can they do additional things? Well, it's going to be relative to how intense is their supervisory oversight? How many people are there? What type of work is being done? What is the risk level with it? So to say yes or no, there really isn't a yes or no. It's going to depend on the circumstances of the work and the type of risk that they're endeavoring to manage and making sure that the handfallers are working to the appropriate level of risk.
All right, thank you. I think we can move on.
Okay, good. So a little more detail on risk management basics. So most of us, hopefully, as you look at this, you're used to the idea of looking at a risk assessment matrix and get an idea of what it's about or have an idea about it, what it's about. But this is part of what the officers are doing now in their inspections when they go out there. So it was launched back in 2022, and it's not just in the oil and gas sector. This was launched across all of our sectors, and it was part of the strategic priority to prevent workplace injury, disease, and death. And it's by that specific engaging employers and workers in workplace health and safety. A lot of this was stimulated around our interactions with employers during COVID and the need to put appropriate communicable disease plans in place. So some of those key principles around risk identification and control now have been developed and are going across all sectors. And as I said, for oil and gas, it links into 23.5. And so key questions at your work site: what are the hazards? And is everyone at the site aware of them? The supervisors, do they understand what hazards are? Do they understand what it means to actually assess the risks? And have you taken the time then to classify the risk? You know, what is high, moderate, and low? And then out of that comes your response to them. Key thing is identifying and implementation of control measures based upon a hierarchy of controls. One of the challenges here is when we look at hierarchy of controls, many of the things that we are interacting with, the hierarchy of control that's been jumped to has been personal protective equipment. You know, and classic example would be falls from elevation and putting people in a harness with a lanyard on it. The person still falls. There's still risk associated with that. If we're going to be moving it up the hierarchy of controls, at the top end, we're looking at those things that eliminate the potential for someone to fall. Is there a way to do the work on the ground? Or if we're going to be up at elevation, guardrails, you know, an engineering control that basically prevents us from falling off that edge or this scenario. The next step is communication. Does everyone know what you're doing and why at your job site? Not just because John Doe or the boss said, but do they understand the reasons why these things are being done? They understand the importance of them. Has there been that dialogue with your workers? And in step 4, what are you doing to monitor and update that approach as needed? Things change. The circumstances of the job change, the progress of the work changes. So are you changing it as needed? And are you looking at how you can keep things as high on the hierarchy of controls as possible as you do that work process? So here's basically what we're looking at. Least effective is down at the bottom. And the most effective is the physical hazard or chemical hazard is actually removed. Substitution, can you replace it in some way? Engineering controls, can you isolate people from the hazard? Guarding, guardrails, things like that. Administrative controls, change the way you do the work sequencing. And the last one is protect the worker with PPE. Sometimes you have combinations as well where they're needed, but the goal is to get you up at least at an engineering control. What are you doing to improve your systems so that you can manage the risks at an engineering level? This is a basic graph that I shared at the Petroleum Safety Conference or Energy Safety Conference. This is a process that we're using to track our engagements with employers. And it asks key questions around, are the risks at the job site that you just visited? So after an inspection, they get a survey, the officers, and this is some of the results that we've had. This one, I'll confess, isn't current. This is for last year, but it gives you an idea of the type of response. So were all the risks, in essence, known and being effectively controlled? So 63% of the sites, they said that, yes, they were. The next one is minimally controlled. So there was still significant risk at that job site. Things were not maybe being as effectively integrated into the job as they could be. And then the last one is not controlled whatsoever. What I would say to you too is there's a difference between controlling risks at a job site and compliance with the regulation. So you may be in compliance with the regulation, but you may not necessarily be controlling all the risks at your job site. So think about that in the context of that challenge, but also take a look at, this has been part of the assessment the officers have been given in regard to risk assessment at oil and gas job sites. So our inspections aren't exclusively consultative, educational in nature. Orders can be written where there are violations found related to the elements of risk management basics. In oil and gas, you have that key obligation for all of your work to be doing risk assessments and then to implement appropriate controls. And additional enforcement tools can be utilized where appropriate. So citation warnings, citation warning letters, or sanctions as needed can be issued as well. So this is another stop point. Lucy, any questions?
None on this section, Bud. All good.
Okay, good. Okay, so this is getting into what are some of the field issues that we've seen in the past year. Occupational disease. I talked about it earlier on, and that traumatic level of the number of fatalities continues to be a significant area of concern. This year, it's even. I would expect probably by the end of the year, by the end of December, occupational disease claims probably will have eclipsed traumatic injury. They have been doing so for close to 10 years now. So what are some of the key things that you need to be doing? And this slide is a repetitive slide. It's not something new. We brought this up numerous years. Do you have monitoring programs and exposure control development programs in key areas in your sector? Silica. This is generated through some of the operations that we're doing around drilling. So geophysical silica can be a significant. Fracking, it's not so much that it's generated, but it's brought in because of the amount of sand that's used. But ask yourself, in the work that you're doing, is there the potential for silica exposure? One of the areas that we find a lot of silica exposure in the Northeast is just driving dusty roads in this country. There's lots of silica dust on the road. So do you consider that when you're looking at vehicle driving on these dusty roads? You know, changing the filters, in-cab filters out, keeping the windows up, don't circulate outside air. You know, and changing all of those filters on a regular basis. Next one is lead, especially older facilities with lead paint, things like that. Are you having the potential for exposures there? Solar, you know, occupation, not the, I won't call it occupational exposure, but exposure to UV radiation and skin cancer is a significant concern. A large growing area of cancer-related deaths relate to UV exposure. And so what are we doing to mitigate this as we are working with our workers in the outdoor environment? Slathering on different things like sunscreen and stuff like that is not as effective as wearing appropriate clothing that protects you from that. Continue to drill with hydrocarbon-based drilling fluids. So what are you doing there to make sure that people aren't being overexposed? And this is an area where you want to think about, are there areas of engineering control? What can we do differently? Diesel exhaust, again, known human carcinogen. What can be done there to make sure that diesel exhaust is not being exhausted into the key work areas where workers are at? Benzene's well known in the gas stream. Mercury in the streams for the different gas streams, different fields have higher levels of mercury, but especially when we're doing turnaround work in our plants, there's mercury has an affinity to aluminum and magnesium. So be cognizant of that when you're doing turnaround work. And the good thing about it is it dissipates fairly quickly when we expose it to the air, but we want to be monitoring for that. Hearing loss. I think I brought this up for at least 5 years, and the hearing loss bubble continues in the oil and gas sector. They expect coming up here shortly about a 30% increase in hearing loss claims in your sector. So making sure that people are two things, are wearing appropriate hearing protection that actually they know how to use and that they do use, and that they're getting annual hearing tests so that you're able to monitor and be aware of what's happening. Norms, naturally occurring radiation, potential exposure. H2S and all designated substances require ECP. So some of the things, sensitizers, this is a specific example that you find in pipe coating, but there's lots of sensitizers out there. And so when you're looking at your basically product information sheets, your SDSs, and it talks about it being a sensitizer, does that now kick in that you develop an ECP? Or even better, are you able to look at something that you can substitute that is no longer a sensitizer being used that way? I highlighted the next one. Welders and welders helpers need to be wearing appropriate respiratory protection selection criteria. This is something that is well established under IARC around the human carcinogen nature of welding fume, especially the particulate. And so any type of welding that we encounter, the welders and welders helpers who are exposed to this need to be wearing appropriate. And I say that's appropriate, and it's going to be based on the duration and type of exposure, also the products that they're welding. So the longer you're working and welding, so if you're doing it all day, yada, yada, that sort of thing, you should be into a PAPR, versus if you're doing occasional welding, it might be a half-mask respirator, but that needs to be something that's assessed and appropriate selections made. I talked about it earlier, MSI risk assessment and risk control. The obligation to the employers is, let's begin with the assessment. What are the MSI risks? And out of that, what are the controls that you can put in place that will eliminate it? And if you can't eliminate it, what are the things that will mitigate it? So ask yourselves, have we even done these risk assessments? Yes or no? If we haven't, we need to. And what can we do to make it better? That's a key thing that we want to be doing. Part 5 of our regulations, 48 through 59, outline what's required around site surveys for ECPs, and they give you specific detail. Often our hygienists, when they're looking at this, they'll say that key elements of the assessment are missing around the site surveys. So make sure that you cover it off in appropriate detail, and then you come up with the appropriate control measures. So this is something that's going to become a continued dominance on our agenda in BC. We're actually revising some of our internal departments to have an expanded occupational disease program across all sectors, because we want to interrupt what's happening in the occupational exposure disease registry, as well as the fatals that are occurring in the province. Fires and explosions. We thought we were having a bit of a quiet year in regard to this, but recently we had 2 fires and explosions back to back. And so it raises that key question around, are we looking at the risks in regard to the work that we're doing? And have they been adequately assessed, and do we have appropriate control measures in place? And if you're getting to answers that are saying no, or where I don't know, then you need to be doing a better assessment and coming up with better control measures. Looking at all potentials for the generation and release of flammable vapors and materials. What are you doing? What's the activity? Fracking and all of its related components to doing a frack. Where are the areas that flammable product and vapor basically could be released? And what are we able to do to make sure that we're controlling that risk appropriately? Times when we're drawing down on tanks, so 400 barrel tanks or larger, thinking about the agitation potential inside that tank as we draw down on it, the static electricity that's being generated, the vapors that are being released. So what are we doing to control that? Hot oiling, we're basically working with a flammable medium. And so what do we need to do to make sure that we don't end up with a fire? That we're doing the mitigation factors that we need to. So what are you planning to do? What's the scope of work? And it begins with that. What are the permits and monitoring that is needed? What equipment is needed to do this properly? And then what personnel need to go with that to make sure that the risks are assessed, that the control measures are in place, and especially the critical controls are in place. Critical controls are your last lines of defense. Like if they're not there, there's a major potential for something to go boom. So what are you doing to make sure that they're there? And in your personnel, do they know what their job is? Do they understand their role? And have they been trained adequately to meet that obligation? How could vapors or flammable gas be generated or released during the work that you're doing? How are we monitoring the hazardous atmospheres? What type of monitors are we using? What type of training do the workers have? And are the ignition sources being adequately controlled, including static electricity? Anytime you have a vac truck drawing down fluid, flammable fluid of any sort from a tank, you need to be thinking about the potential for vapors to be released and static electricity to be a potential ignition source. So my last comment in regard to this is a lot to do with your due diligence here. This activity is more than checking the boxes on a checklist. It's actually doing those things, and make sure that they're being done appropriately, properly, timely, and continuously as the work on a job site evolves. Because that's really going to be a key part of your due diligence and the efforts you need to put in place to make sure it's safe for your workers on that job site. This goes into it, grounding and bonding. It's a critical issue to controlling ignition sources. Do you know the difference? If you go to one of your job sites and you ask the question, do workers know what the difference is? Do they know how to, in essence, tell what the difference is? Operators providing appropriate grounding at site, whether it's a temporary work or a permanent location. Have you designated a grounding location? Have you installed it properly? Has it been tested? Differential instrument for checking bonding, also proper calculations required to ensure that the ground is adequate out there. Does everyone who comes in and needs to use the bonding and grounding or be part of that process know where the attachment points are? Do they know how to attach their equipment? Is that checked? And to make sure that it's actually functioning, do you have a proper and used ohm meter, basically, that is being used by the operators, and they know what type of readings that there should be, what type of resistance would be maximum allowable. And with that goes hand in hand the training and the education of the workers. It's not just giving them a tool, but it's actually teaching them how to use it and how to use it properly. So some of the other general things, traffic control on secondary highways. Remember, they're part of the provincial highway process in British Columbia. 2 years ago, Part 18 was revised, which is the traffic control section for travel along roadways. And if you read the regulation through, especially in the first part, you'll see that it requires you to be doing a risk assessment and to develop a traffic management plan for the site, to make sure that you have proper signage. We often see in rig moves and pipeline construction just a sandwich board. Well, the traffic control manual and requirements require you to do more than that. You have to have proper signage. And you need to make sure that your workers are trained in the new traffic control requirements. They understand it and they know what it takes to make sure that it's functioning properly. Another key thing is to think about the order of control measures, because it talks about the obligation of an owner and an employer to extent practical, eliminate the risk of worker exposure to traffic in a work zone by isolating the work zone using constructed detours, alternate routes, barriers, or other effective means. So this isn't something that's just sort of put onto the workers. It actually begins with the owners of the project who commission the work. And then the employers, what are you doing to, in essence, begin with a risk assessment and to eliminate the risk of worker exposure to traffic in these control areas. Emergency washing facilities. So this has been around for a while, but it's raised its head again. Where are they required? Employer must ensure that appropriate emergency washing facilities are provided within a work area where workers' eyes or skin may burn or irritate. So think of all the different types of work that you do where that could be a potential. And you have lots of them, lots of product out there, things that you often do on a routine basis that you maybe haven't thought about for a while. But ask yourself, when we look at the SDS on our products, is there the potential to damage a worker's eyes or skin, to burn or irritate them? Then you have to do a risk assessment and look at the selection of emergency washing facilities based upon an assessment of the risk present in the workplace. And it basically says that a transient work site, you can use portable contained units, but they still have to, in essence, provide the same type of response and ability to wash a worker as needed. So take a look at that. What are your risks? What are you doing? And what type of a system do you need? Excavation work. Now, this has raised a number of situations recently where there's been excavation work being done. So 20.78 talks about work standards. So excavation work must be done in accordance with the written instructions of a qualified registered professional if the excavation is more than 20 feet deep, or an improvement or structure is adjacent to the excavation. And this is the most common omission, is that employers, those doing the work, are forgetting to take a look at what is an improvement that, in essence, has disturbed the soil and may impact the excavation in a negative manner. Talks about vibration, hydrostatic pressure, ground slopes, all of those things. So if you're doing excavation work, you need to take a look at whether you're following this. Do you have the written instructions of a qualified registered professional in this area? There's been a recent slate of hand injuries and amputations in different aspects of the oil and gas sector. So we saw 3 serious hand injuries and amputations. Number 1, safeguarding of nip points. Anywhere where there's a crushing potential, what do you have for guarding that is effective and is going to prevent fingers, hands, other body parts from protruding into those areas? Proper use of tools for things like bolt torquing operations. You're going to be doing something that has the potential to injure a worker. Do you have the proper tool for it? And you want to make sure that you're doing that appropriate tool selection so you don't generate a situation where the worker gets injured unnecessarily. Part 12 of our regulation talks about the obligation to protect the worker from contact with hazardous parts, points of operation, or ejection. And so you want to make sure that the safeguards you put in place are effective and are going to do what they need to do to protect the workers. This one is not specific to the oil and gas sector, but it's something I want to bring up, and we're bringing it up across sectors. We plan to do a couple awareness articles on this, but year to date in BC, we've had 4 fatalities and 1 disabling incident with ATVs and UTVs. And it's been across a number of sectors, not in just one. A bit of the challenge is that UTVs and ATVs are both tools that at times can be kind of fun to use. But we want to think beyond having fun. What are the risks that are associated with operating these machines? And then what do we need to do to mitigate those risks? And that's part of what we want to take a look at. We're heading into, in essence, a spring season coming up in a few months. Lots of ATVs, UTVs will be pulled out in your oil and gas sectors. So ask yourself, things like excess speed. What are you doing to monitor, manage, and control the speed that these units are used in? Because they can be fun to drive fast. Lots of people do it recreationally, and they go out and they drive fast. But on your job site, it also can have pretty significant consequences, excess speed, when they lose control. And we've seen that in a couple of these incidents, that excess speed was a huge factor. The next one is exceeding slope limitations. Have you got procedures that basically outline maximum slopes for these units, where they can run, where they can't run, what's the maximum grade that they can run on? Other big common one is operators of especially UTVs not wearing helmets, and with that, not wearing their seat belts when they're operating these machines. So life-saving within the UTV is seat belts and helmets. And we saw in a number of the fatals that the persons who were in the machines in the upset condition, if they had been wearing a seatbelt and wearing a helmet, the injuries that they suffered would have been survivable, or not injuries, the circumstances of the incident would have been survivable. Then we look at it within the context of that, what's being done for oversight and supervision of the operators of it. Something that's a little maybe not as well known is safeguarding front floorboards and doors against protruding objects, so J-pokes. Many of these units come with plastic floorboards, and so as you're driving along at speed and you have a limb or a treetop or protrusion like that come up against the bottom of the UTV, it can protrude right through and end up skewering a passenger or an operator. And that has happened and caused fatals on a number of occasions. So take a look at the requirements. And as we move into 2024, let's see what we can do to make sure we don't have any more incidents in these areas. So here's the two sector questions I talked about. First one was inspectional focus areas in 2024 into the future. So the last few years have been dominated by pipeline activities in BC, Coastal GasLink, and TMX. And the recent uptake in upstream activity to meet contract obligations will see more inspections in those areas. So the reality is these big projects are coming to an end into the early parts of 2024. CGL has basically come to an end on the mechanical side, some cleanup and that to do. TMX is getting close to being completed. And so as that occurs, we're going to be starting to look more at the upstream side of things, drilling, completions, etc. Next question is, what's needed to resurrect equipment that's been mothballed for a number of years? Basically, you need to have a plan. And what does the manufacturer say is required? And what standards are applicable? And the equipment that's been sitting there, can you basically come back and say that it meets, CSA, ANSI, API, ASME, and some of the COEC standard requirements? If you can't answer that question, then it basically needs to be brought up to standard. It needs to meet manufacturer specs or the specifications outlined by a professional engineer. And there's been a lot of equipment that's been sitting around for quite a few years now. So we want to make sure that it can be safely resurrected and safely operated and doesn't pose risks just because of the degradation that may have occurred while it was sitting. I talked about this earlier. This is basically the first aid services, supplies, and equipment, written procedures that are needed. Here's some of the details. The guidelines for first aid. See the conditions for using an MTC in place of a dressing station or first aid room. So these are some of the things that you want to be looking at in your first aids, because I'm going to be getting into the updates to the first aid regulations here at the end of this. Also, first aid attendants lacking adequate communicable disease and bloodborne pathogen trainings and exposure control plans. So any questions on that section, Lucy? We're at a new break.
Yeah, and we're also at time, but we can keep going, Bud. Anyone who has to drop off, a reminder, this is being recorded, so the entire session will be available on our website at a later date. So the question on this section is in regards to emergency washing facilities. How does that affect a drilling rig location? Are the eyewash stations and a shower located in an on-site trailer adequate?
That's actually a good question, because the assessment requires you to take a look at distances in regard to the type of product that you're using. So it might be a situation that it could be adequate if the SDS requires body irrigation for a certain period of time, and you can get the person to that very quickly. But it may not be adequate if it's quite a ways away from the work location. Typically, eyewash stations are in the doghouse, and if they're maintained properly, they basically can meet requirements for washing the eyes. But you may have some challenges with washing the body if that shower is too far away. So you need to go back, do that risk assessment, and come up with the appropriate response and plan for that.
Okay, thanks, Bud. That's the only question.
Okay, so the final section here is the occupational first aid regulatory changes. So Amendments to the requirements relating to the provision of first aid were approved in April of 2023, so this past spring. Now the changes will take effect November 1st of 2024. They wanted to make sure that employers had lots of time for the implementation to arrange the required training and obtain any equipment as required, because some of this is significant change there. So the amendments, why are they changing them? Basically, they've been in place unchanged relatively for about 20 years. And it was recognized that there's been a lot of improvements in first aid training and equipment. And there's been 2 new standards that have come out, the CSA standards, and they're basically talked about there. So for first aid training for the workplace and first aid kits, and they wanted to make sure that they were part of the goal to harmonize nationally. There's been lots of requests that have come from industry groups that work across provinces to make sure that we can do things to harmonize what we're doing. You know, in essence, we have the same standards in Alberta, Saskatchewan, British Columbia as you move across it. There's also amendments to strengthen the requirements with particular focus on high-risk industries in remote areas. And that's going to have a big impact on oil and gas because you do work in those areas on many occasions. So basically it talks about the employer duty, a key change, to look at Schedule 3A. So it's been updated. And basically to provide what's needed at a higher level as dictated by the risk assessment. So as you do the risk assessment, you're looking at the table and you may say, hey, we need more. Well, then you have to provide more. You can't just say we did a risk assessment and we're just doing what's required in Schedule 3. In consultation with workers, you have to perform that risk assessment at each workplace to determine any additional equipment, supplies, facilities, attendance, and services necessary to ensure that injured workers can be promptly provided first aid, and you want to make sure that they're transported to medical treatment in a timely manner. So gives you some new definitions around workplaces remote, meaning it's more than 30-minute surface travel time from the nearest ambulance station. Whether the workplace is less accessible, meaning it cannot be safely accessed by ambulance, or it includes one or more hazardous work areas that cannot be safely accessed by ambulance personnel. So not only can the ambulance not get in there, can the ambulance personnel get in there or not? So those are some key new considerations in your assessment. Emergency transportation and barriers to first aid. So emergency transportation is required under Schedule 3A. Written procedures will need to identify how workers will be accessed and moved if there are barriers to first aid. So part of that assessment needs to determine what are the barriers. And then you take a look at how will we access the workers and how will we move them. So barriers to first aid include anything that could potentially eliminate or delay a worker's access to first aid and transportation, including physical objects, hazards, or accessibility challenges for the first aid attendant that they might encounter. And any specialized equipment and training for the crew to overcome these barriers will need to be identified. And now drills will now be required annually or whenever first aid procedures change. So it's not just once and done, but it's basically annually and anytime anything changes to ensure that the workplace specific procedures are effective. They want you to test it before there's an actual emergency. So there's some new terminology for the certification is changing to align with the CSA standard. Instead of level 1, 2, and 3, it'll be basic, intermediate, and advanced. It's not going to affect validity of first aid certificates currently held by attendants, and there's going to be a 3-year transition period for them to ensure that their tickets remain valid until their current expiry dates. However, the number of required first aid attendants and their level of training may now be different as per the Schedule 3A. So employers need to anticipate these changing. Do you have the people you need? Do you have the resources that you're going to need as you get into this? And we prepared a bunch of guidelines and resources. The one that's on the right side is called a backgrounder for occupational first aid regulatory changes. It's available on our website. And basically it will help you work through this process. They're looking at some additional guidelines on conducting first aid assessments, developing the written procedures, and you can continue to monitor the changes on our webpage. So part 3, minimum levels of first aid, they're already working on that, and you can take a look at it. Yeah, one of the last things to continue is mental health safety. And I said this earlier, it's one of the fastest growing areas of occupational health concerns and issues. We kind of announced a year ago that we have an occupational health team that has been implemented. Well, that's been established now, and they'll be doing more inspections around the province and interacting employers around what you're doing in your health and safety program to support maintaining positive mental health at your job sites and to manage that. And that brings me to the end, Lucy. Any other questions?
No other questions have popped up. Last chance here with Budd Phillips, Manager of Prevention. Okay, well, Budd, always a pleasure to have you present to our stakeholders, and lots for us to work with when we develop a plan, and put on workshops out of our office here in Fort St. John to address some of these priority issues. So thank you for that.
Thank you, Lucy, for facilitating this, and we appreciate the opportunity that we continue to have with work with Energy Safety Canada to get the messages out and to help improve things and continue to improve things in oil and